Good evening, good morning, and good afternoon, depending on where you are joining us from. And welcome to the Alan Hu Foundation Mental Health Lecture Series. I am Chi-Ching Hu, co-founder of Alan Hu Foundation and the host of your webinar. Today, Dr. Steven Adelsheim will present Seeking Help Early for Youth Mental Health. The Alan Hu Foundation Mental Health Lecture Series aims to make a mental health knowledge common knowledge. Alan Hu Foundation's mission is to promote mental health, raise awareness, and remove stigma surrounding psychiatric disorders, and support fundamental research for cures. Please consider making a gift to Alan Hu Foundation. Your gift will be 100% invested into Foundation's mission to support mental health. Today, I'm honored and privileged to introduce Dr. Steven Adelsheim. Dr. Adelsheim is clinical professor of psychiatry and behavioral sciences at the Stanford University School of Medicine and director of Stanford Psychiatry Center for Youth Mental Health and Wellbeing. Dr. Adelsheim has been developing and implementing early detection and intervention programs for young people in school-based and the primary care settings. These include programs for depression, anxiety, prodromal symptoms of psychosis, and first episodes of psychosis. Dr. Adelsheim will discuss the use of media to reduce stigma surrounding mental health issues, and his effort to bring Australia's effective headspace model of mental health early intervention for young people ages 12 to 25 to the United States with the Stanford Medicine's innovative program known as allcove. Among Dr. Adelsheim's many honors and awards are the NAMI Exemplary Psychiatrist Award, National Alliance on Mental Illness, Sidney Berman Award for School-Based Study and Treatment of Learning Disorders and Mental Illness, American Academy of Child and Adolescent Psychiatry, and the Bronze World Medal for the film Not in My Family, Associate Producer, New York Festival. Following the presentation, there will be 15 minutes for a Q&A session. During the presentation, you may type in your questions in Zoom Q&A, and we will answer as many of your questions as time allows. Now I'm going to give the virtual stage to Dr. Adelsheim. Dr. Adelsheim, the stage is yours.
Thank you. Let me, I'm going to share my screen and hope people can see it okay. Let me begin by just saying thank you. It's a wonderful honor to be able to talk with all of you this morning, afternoon, or evening about the important efforts of working to support our adolescents and young people. And I want to thank our colleagues at the Alan Hu Foundation for inviting me to share our efforts with you and to talk with you all today as well. It really is an honor for me to be here today. I'm going to speak initially about some of the data that most of us often know about some of the issues around mental health supports for young people, and then speak a little bit about some of the issues involved related to suicide prevention because of the community where I've been working both at Stanford, where I've been for the last 7 years, but also previously where I worked in the state of New Mexico, again on similar issues, as well as school mental health and early psychosis related work. I want to share with you also some of the comments from some of the young people that we've been working with around this COVID situation and how they've been addressing these issues, the concerns that have been raised, and then also talk a little bit about allcove as one of our efforts around early intervention support. So as I begin, just some of the things I want to remind you all, and many of us as parents, as community members, have heard some of this information before, but it still is really surprising when we recognize that half of all lifetime cases of mental illness have their onset by the age of 14, and the fact that 3/4 of them actually start by the age of 24. And when we look at this data, it's something that we hear people talk about, but we really don't think about, like, what in fact does it really mean that it's so difficult to access care for mental health conditions at an early age when it's so common for our mental health issues to start so young. And in fact, at the end of the day, we know that 79% of young people under the age of 18 are even unable or unwilling, or through their families don't access care. When we look at this other graph here that on the slide as well, the bottom line there is age. And one of the real reasons for showing this, and this is from our colleague Pat McGorry in Australia, is that when we look at all health issues among young people, particularly between the ages of 10 and 30, young people mostly, in terms of other physical conditions, are generally doing well, but by a vast majority, the health issues of young people between the ages of 10 and 30 are mental health related. And so it's really striking that we don't have the supports in place for them. When we look at the national data from the US recently in terms of access to care and need, frankly, the data is pretty depressing. We see that, major depression is continuing to increase. We still have huge issues, again, even across the country, of young people specifically with major depression who are unable to regularly access care. Our national data says that suicide rates across the lifespan have been increasing in all of our states over the period of years from 1999 to 2016, and continue to increase, particularly for our African American young people, which are being particularly recognized as a group at increasing risk right now, and among our other populations as well, and particularly Native American youth, who have the highest rate of youth suicide in the United States. To briefly kind of share a little information about how the COVID situation has impacted the issues for our young people, the slide might look a little complicated, but that bottom solid line is proportion of visits to emergency rooms for pediatric visits in 2019 that were for mental health related needs. And the main point to understand is when you look at the dotted line for 2020, quite an increase has taken place in terms of the number of pediatric emergency room visits over the last year that have been mental health related. And when you look at the age group at which there's the greatest increase, again, it's this adolescent population, 12 to 17 years, where from 2019 to 2020, we've seen major increases in emergency room visits in the pediatric world for mental health related conditions. This recent survey done in the spring was also looking at our young people in a sense of how connected they felt to school, given the changing situations around doing video education and school activity taking place in a really different way, in a really different world. And what we're seeing at this point is, young people struggling at times to feel more connected to school, and seeing difficulty connecting to the adults at school as well. And really, though, the connection remaining to classmates, but again, not as connected as we would hope young people would be, or as maybe they've been in the past. And when we look at this among different ethnicities and racial groups, we really see for our Asian youth and particularly for our Latinx youth, particular stresses in relation to accessing school, but seeing them increased for all of our young people. And then particularly one of the questions was really for youth who have parents maybe that are born outside of the United States. This may even be a particularly larger issue in terms of transitioning to a different kind of way of going to school and being in different kinds of academic settings. In California, just to show some consistency with some of this other national data, what we see is that really there are a lot of young people that are dealing with depression. And again, very few of them are actually able to receive care. So, we've had a huge issue, and this has been one actually prior to the current pandemic as well. So, the reality when it comes to youth mental health, and this is again from our colleagues in Australia, is that accessing care is really difficult, whether it is due to workforce issues or stigma issues or cultural issues. It's been really difficult for young people to access the care and support they need, given the kinds of conditions that we see. And usually when we do see services for young people, and here this is referencing at the bottom of the cliff in Australia, what it really references is that we really don't have services that are easily available for young people when things just become a problem or early in a process in terms of a need of support. For most of our programs and services, they do begin in the emergency room, or they do begin after a suicide attempt or a drug overdose or some other kind of crisis, rather than building the upstream types of services. This wheel that was put together by the Institute of Medicine really tries to lay out sort of what makes sense as a continuum of care for public health and mental health related kinds of interventions. And what we usually see for most of our services is programs that really begin at the point maybe of case identification, but usually in an emergency situation, and then treatment, and a lot of resource and support, which is critically necessary for longer term care or more chronic kinds of support. And what we've really missed for a very long time is that early intervention kind of support, whether we're looking at universal programs for mental health support in schools, which are certainly increasing, and the ability to identify young people at risk and link them to early kinds of supports. When we think about this case identification issue, one of the questions that it raises is this question of screening. And are we involved in doing screening, whether it's in schools or other kinds of settings? And what does it mean to be involved in doing screening? And for a lot of families and a lot of individuals, screening is problematic. Some of these issues around mental health are very personal. It isn't the business of the school or the primary care provider to maybe have that information. But in many cases, when we can identify issues early, we can intervene early and really help young people stay on track from a very early point and then consistently over time. And then if there is a bigger problem, we can intervene early and maybe prevent less risk in terms of other kinds of conditions developing, which is true in the early psychosis work that many of us have been involved with as well. One of the reasons that this is also important as we think about schools is that, young people who leave school are really often the young people who are dealing with a mental health condition that has not been recognized or appropriately addressed earlier in their educational career, maybe not recognized in elementary or middle school, and then it becomes a problem during transitions in middle school or transition to high school. And without that recognition, young people may leave or may not do well in a special education classroom and decide to leave school. So this is an issue where early intervention can also be really, really important. Plus, we know that this is the population, really these young people, 12 to 25, are the young people that are least likely to get any kind of health care of any age group whatsoever. So we're dealing with a group at increasing risk for mental health conditions who are also least likely to go in for any type of healthcare whatsoever, which is why we're often missing them before things are too late, before young people are in emergencies or things get really difficult, and why maybe even more important for us to be thinking about building out these early intervention models. As I shared with you early, by working at Stanford, I became very involved in a youth suicide crisis really in the Palo Alto area. When I moved to Palo Alto with my family, my youngest child, I have 4 children. The youngest actually moved with us to Palo Alto into middle school in the Palo Alto schools. And really in her second year of middle school was when what was really the second youth suicide cluster took place in the Palo Alto community. I'd been involved in doing school mental health work for many years in New Mexico, had been involved in dealing with crisis response, trying to decrease youth suicide clusters across the state of New Mexico, and got re-involved with my colleague, Dr. Joshi, who some of you maybe have heard present before, and other colleagues in the community to address this issue that they've been working on for quite a few years. So I don't know how many of you are familiar with Project Safety Net, which is a wonderful community continuum of support that was developed at this point well over 10 years ago, and at the time of the first youth suicide cluster, to really address what was seen as a mental health and suicide risk crisis in Palo Alto. It was brought together by Luso Packard Hospital, the city, the school district, and many, many health and mental health and family partners. Had a very active youth voice as well, and has been very important. The HERD Alliance has been really the group of health and mental health professionals from the community that started meeting at that point as well, and have really worked hard to develop interventions. And you see there a link to a website there, the HERD Alliance Help Toolkit, which has really become this wonderful model of suicide prevention and postvention, targeting schools to help schools develop their suicide prevention programs, help school districts develop their plans, and has really become a state and national model with all aspects of support to build resiliency, decrease risk, and then also how to address a crisis situation should there unfortunately be a loss due to suicide at some point in time. As many of you know, Santa Clara County also, as a result of this and through the Palo Alto schools, brought in the Center for Disease Control to meet with the community and do a study of this youth suicide risk within the community. And I know this is a busy slide, but at the end of the day, there were 13 real recommendations from this EPI-AIDS study to consider for suicide prevention strategies. And here's a pretty active list. A lot of them, as you see, are prevention, multiple prevention approaches, building access to mental health support, building family support, the school-based connection, developing postvention programs, and looking at prevention in other ways. Number 10, safe messaging and reporting about suicide is what I'm going to talk about a little bit more. And then, the importance of evidence-based kinds of interventions and the strategic planning process. So I want to briefly highlight some of the issues related to some of the school recommendations. And I show this slide to you now because, our focus at our Center for Youth Mental Health and Wellbeing is really on building this public mental health continuum of support, really beginning with school health and school mental health, moving to this allcove model, which we really call integrated youth health and mental health services, and then linking to what's been a real national effort to expand early psychosis programs or programs for people at clinical high risk for psychosis, and linking these three together in a way that gives young people ways of accessing supported school or in these community settings that we'll talk about, and very early at the beginning of a serious mental health condition, like for early psychosis, we really have a way of building that continuum that allows young people when they're 13 or 14 or starting to wonder if they're dealing with a mental health issue, access points to go in comfortably for early care and support. I want to quickly mention in terms of the school-based pieces, the importance of school districts partnering with community. Schools can't do this work alone, and community partners really need to partner with schools around early intervention. One of the areas I used to work in for many years in New Mexico was in the development of school-based health centers, which were often run by community partners that then linked to schools and provided integrated care services, mental health, primary care, early screening. As many of you know, Alameda County has really been a leader in the state in developing these kinds of models around school health. We often don't see as many integrated sites as I did in New Mexico, where you have both primary care and mental health together, which allows for young people to have less stigma. They're sitting in a waiting room, whether it doesn't necessarily mean they're going for a mental health visit. They could be going to the primary care provider. In many cases, for the young person who may not feel comfortable talking about a mental health condition, it might take till the second or third visit talking about their stomach aches or their headaches or their other health issue before you get to the underlying mental health condition. And then generally from the primary care provider, there's an easy warm handoff to the mental health professional who's also in that clinic to be able to provide support. In addition, the school health and mental health professionals are critical providers of mental health services as well. The role of the school nurse is a critical one in terms of supporting the continuum of care and helping make critical linkages of support as well. One of our partner programs at Stanford, the Challenge Success Program, has been an important partner for us to think about. And one of the things that they also consider for schools is how to create an academic environment within a school setting that decreases stress and supports young people in order to be successful. The Challenge Success Program has lots of great ideas and recommendations for schools, school districts, families on how to create a culture within school that feels very supportive to everyone involved and maybe finds ways for students to feel more easily successful, and really also raises questions of how we define success that we'll come back to in just a minute as well. In addition, another program that's been very successful, particularly from a suicide prevention perspective that is generally school-based, is Sources of Strength, which is a program that was developed actually through a tribal community in North Dakota, and then has really taken off across the country as a way of building school culture that supports young people to feel comfortable talking about mental health issues. The Sources of Strength program trains leaders within the school to be able to have conversations with their friends and colleagues who might come to them around a mental health concern, and then be able to have a conversation with that young person to figure out what kind of supports they need and strategies to link that young person through a peer to a caring adult who can get them to the right services, while also building within the school this culture of support that you see sort of within this pie piece here. Media has been an important issue for us to address, as I mentioned earlier, as it relates to suicide prevention. Our colleague, Joe Robinson in Origin in Australia, worked with many young people from across their country to develop the Chat Safe guidelines. And together with the JED Foundation, we were able to work with them to look at how we might translate these for young people here within the United States. So if you look up the Chat Safe guidelines, they're really for young people to understand how maybe to talk using social media about suicide in a way that's safe, that doesn't increase the risk for someone to harm themselves, that doesn't give people ideas about maybe hurting themselves, but gives strategies for how to communicate in a safe and supportive way with friends and colleagues to be able to address suicide risk online in a comfortable and safe way. As I mentioned before, the media issues related to reporting have been a very important one as well. Even before I came to Palo Alto and Santa Clara County, this was a big issue that we were trying to address with partners across New Mexico as well. So, when we look at how one addresses issues related to youth suicide, we get very concerned about risk and the risk of contagion. And when we think about that, we realize that the way articles write about young person's death by suicide really can have an impact on the chance that some other young person might decide to die by suicide as well. This article that I keep showing you on this slide, the Silicon Valley suicides, what I have to tell you is it's one of the best examples of a really terrible article when it comes to writing about suicide. It violates almost every recommendation, both in terms of the photographs, in terms of the names that are used, in terms of talking about means. And one of the only real positive aspects of this article in The Atlantic actually was the letters to the editor that they've agreed to continue to leave posted from young people and families in the community of Palo Alto, describing their responses to the article and the pain that it caused the community, the way it was written, and the comments that were made within it. So, one of the areas that we continue to work on is helping our media partners understand what are best practices. And, there are these national guidelines with things that you do and things that you don't do. And on average, when the Center for Disease Control looked at this issue across over 250 articles about the suicide losses in Palo Alto and Santa Clara County, on average, when you look at the practices to avoid, the articles on average still did 4 of the things you shouldn't do. And in terms of best practices, generally did 1 to 1.5 of the things you should do on average. And so we have these guidelines, but one of the real issues is then even how do we help our media partners not only know about them, but follow them, which, is a really big issue. So fortunately, actually, we'll talk about our youth advisory group for allcove in a few minutes, but some of the members of our youth advisory group actually created their own organization to address this issue, Youth United for Responsible Media Representation. And they are all young people from the Palo Alto community that sort of became watchdogs that would see an article that was inappropriately written and then go to the people that wrote it, would write the journalists involved, go to the editor of the paper, and let them know that they weren't doing a service to the community by writing an article that would increase risk. And so this is an area where we're continuing to work with our young people, but also more broadly with our community as well, to address this issue, both locally, but also across the state and with other state partners, but also with other partners around the country. I mentioned earlier, that I'd be talking about allcove, and I just sort of want to remind you about that for a minute. And what I really want to talk about is our youth advisory group for a minute, because these are the young people that have really been critical to developing the name of the program, the core components of the services, and the expertise of our young people has been really important in building out the model of care. But I wanted to share with you some of the comments, not only that they have raised about what this time has been like, but also what it's been like as they have surveyed other young people. So, part of what they're seeing is when you ask them to name one word that describes how you felt about quarantine, they really range from unmotivated to hopeful, confined, melancholy, serene, sleepy. Actually, sleepy being a really big issue that will touch base about. But part of what's been hard for many young people is people telling them often how to feel, how they should be responding. As much as people sort of acknowledge the losses in terms of special lifetime components and events that are important in terms of whether it's prom or graduation or other ways of celebrating major moments and losing them, allowing our young people to grieve them has become really important. And I think many of our young people continue to miss each other, whether it's like not seeing each other in the hallways or being able to just even run into people in a way that used to happen and we used to take for granted has really continued to be a challenge for our young people. So some of these things that we've heard them talk about, and I'm sure your families are facing these issues, and the young people, if you're working at a school or working in your community, you're seeing these as well. But this sense of loss of control has really been pervasive, and often with it a sense of hopelessness. For many young people, sort of like this Groundhog Day sense of waking up in that movie where you keep doing the same day over and over and over again, and you lose track of time. The sleep schedule gets off. People are often eating a whole lot more than they have before because they're bored, or losing those routines out in the world. As mentioned before, the connections are smaller. And then also still seeing people from a distance look, whether they're happier or successful or they're getting lots of likes. And also in a world that's really chaotic right now. And there's lots of fear, there's lots of loss, there's lots of death, and there's uncertainty about where we're headed, not only locally, but often as a country, and where we fit within the world. We have a vaccine coming, but how real is it? How safe is it? Are all questions that people are struggling with as well. What we're seeing, from our young people, they're really trying to find ways to build peer-based connection, and really recommending we all work on that as well. Some of them are, getting off of social media and actually using mail and sending each other postcards and writing each other letters and finding other ways of connecting that frankly haven't been as familiar to them. They're looking at ways of spotlighting stories of resiliency and positive change that I think have been really valuable as well. Some of the other solutions that keep coming up in all the articles one might read, or ways of thinking about building support, include, how do we build physical activity into our lives in really important ways to manage stress? Can we move to structured schedules that allow us to sleep consistently, be able to do activities in a consistent way, to ensure we have time for leisure as well as work? And I know, like, for some of us, differentiating work from rest and leisure has been really hard. And as people aren't going on vacations, it feels like everybody's working all the time. And so there are real challenges around that. Some of the things that seem really important are checking in frequently with our young people. And even if our children don't really even want to talk to us, they really still want us to check in. So it's really important to ask, how are you doing? How are things going? What do you need? How did online school go today? And to keep doing that consistently, even if we're not getting a positive sense. Our young people have been telling us, we need you to ask us how we're doing, even if we don't want to tell you. It's important to be asked. And I think one of the other things that comes up in lots of situations for families is, to really also be able to talk about how we're doing as parents, as adults. And the more open we can be around our own feelings, our challenges, whether it's now or at other times within the world, to talk about maybe our own mental health challenges, times when maybe we weren't so perfect. There's a sense that our young people often feel such a need to be perfect and successful, and they don't often have a sense of the times where we sort of face those challenges. And we don't often talk about them, and we don't talk about the mental health issues in our relatives and in our families. So our young people just see often us as being very successful, and they don't realize the mental health challenges we have all faced, the failures we've all had. And often that just leaves this great sense of expectation that may not be based in the reality even of our own family. And as much as we want our young people to have everything and be as successful as they can be, part of the question becomes, what does that actually look like? And how do we really want to define success for our own children? And for some of us, it's about what college they get into, or athletically what they're able to achieve. But for some of us, it also might be, are we raising kids that are really kind? I would say within my family, with our 4 kids, raising really kind kids has been really, really important to my family as well. Helping develop young people who can be resilient and find ways to face challenges successfully. Our colleague, Julie Lithcott-Haynes, in her book about how to raise an adult, based on her experiences working as a dean of freshmen at Stanford, and was really struck by some of the skills that the freshmen at Stanford did not have, came up with this list of things that might be important for an 18-year-old to be able to do. And, many of them are things that they can learn while they're living at home right now during a pandemic, and figure out how to have the conversations they need to have, even if they're online, how to be able to contribute to the house, how to be able to handle challenges at home, how to be able to find coping strategies. All of those become really important. For parents, for those of us that are all dealing with having our kids at home, I recently came across this guide that looked like it might be something that just could be helpful. So I wanted to share it with suggestions for parents about, how to take care of yourself in the context of this time where we're trying to juggle, whether it's our work, with our child's school, with the challenges we might have financially or otherwise, and how do we take care of ourselves and our children during this really difficult time. In the last few minutes that I have, I want to talk a little bit about this allcove program, which, really for me came about after working in school mental health for many years, after working in early psychosis, but really feeling like there was a need to find a community-based model to support young people around early intervention. And I reached out and learned about the Headspace program in Australia, and then ultimately about other international models like it, but felt like it really was a framework that filled what to me was a really critical gap in allowing our young people to get early support. As we talk with young people around the country around, their challenges around mental health support, part of it was a sense that sometimes things are just too busy and there's too much happening at one time. But also that, there are also challenges to taking a risk to get mental health support. You see there number 5, often engaging with mental health supports might mean going against family and cultural influences and values, and this sense of needing people to listen a little bit better. So as we developed the allcove program, what became important was for us to create with the young people we work with a place for all young people to come for early mental health and health supports, and a place that was safe, that could allow young people to be able to feel comfortable getting the support that they need in a way that allows for and is created in a culture that supports young people. When you look at the models of these kinds of support, they don't look like typical kinds of clinical programs. The idea is to create a space that normalizes mental health support, that really looks like it's geared to and for and by young people, that has integrated supports. And as we're working to develop this model in California, we really want to do this in a way that will not be a cost for our young people, but be able to work with our systems to be able to provide the financial support to be able to provide this care, along with this prevention and early intervention focus. You see here what are sort of the core services of the allcove model. You see, kind of like the school-based health centers, mental health services, primary care, support for education and employment, early addiction treatment is tied to that, as well as peer support services and families. And then to be able to link people with higher end needs or that need more intensive support to the other supports that they might need, or housing support if someone needs housing, or referrals for particular programs. And the idea that some other programs, like an early psychosis program or an eating disorders program, might come on site, for part of the time to be able to do warm handoffs for the types of services we're talking about. Just so you know, these models have been growing up all over the world for quite a while now. And as I mentioned, Australia, now has over like 130 of these sites. And Australia, just so you might remember, is half the population of California. Denmark, had 8, but that's now grown. Ireland has 16. Our colleagues at Foundry in British Columbia are now up to developing 18 sites across British Columbia. They're growing across Ontario. And, our plan and hope is to open the first 2 in the United States in Santa Clara County, in Palo Alto and San Jose this spring. But even as you look at the pictures of these sites, there's direct messaging for different cultural groups that got a lot going on. It's part of the marketing campaign for the Aboriginal and Torres Strait Islander Indigenous population in Australia. You see the buildings, whether it's Jigsaw or Foundry, are trying to create spaces that feel comfortable for young people. As I mentioned, our young people have been very involved in all aspects. And as we're helping other communities develop this model, part of the work is around helping them develop their youth advisory groups in a more effective ways. And as you see, they do a lot of research. They've been involved in speaking to state agencies and legislatures with us. They go and visit the potential facilities to select the sites with us, and are very involved in all aspects of the program development. Part of what we're trying to do is develop a model that we can implement in multiple sites, initially in California, but with partners, there's been interest developing in other states as well. And so we have core components that we want to be sure are in place for the integrity of the model. And because we're building it from scratch, we have this wonderful opportunity to work with new sites to ensure that all the core components are in place across these multiple areas, including the clinical services. We'll be developing a learning community for other interested partners that want to develop this model. We want to be able to ensure that we follow all the informed consent and confidentiality laws for both California as well as the national ones. We're going to do a common evaluation. We're going to ensure that we're building strong community and family partnerships, as well as linking those services. The state of California, through the Mental Health Services Oversight and Accountability Commission and the governor's office, put out additional funding to start additional allcove sites. So we will be partnering with the state, not only for the sites in Santa Clara County, but in supporting the development of a site in Sacramento, in northern San Mateo County, 2 sites in Los Angeles, Orange County, as well as with our colleagues in Santa Barbara. And these will be the initial sites that we'll be working to develop together. This just gives you a sense of who our partners and supporters have been, and sort of the vision for this model as we take it forward. So, as I close, there's a lot of work that needs to be done to support our young people. We need to be building these models of early intervention and access, and looking at these linkages from schools to whether it's allcove sites or something similar in the community, and then linkages to early intervention, even for people who are developing serious psychiatric conditions like psychosis, because we know that recognizing those issues and symptoms early and managing stress levels will decrease the risk for those young people and help them stay on track in school or in employment and be successful, which is why our state and our country has made real commitments to these types of services. So with that, let me say thank you. I appreciate the chance to share all this with you. And let me stop sharing my screen in just a second here, if I can move this, and we'll go on from here.
All right, thank you very much, Dr. Adelsheim, for the wonderful presentation. Before we going on to Q&A session, we have some more information to share with the audience. These are the useful information, the resources regarding the positive parenting during pandemic from Stanford Psychiatry Center. So audience, if you are interested, you may check out this information. Now we are open to Q&A. We have several questions to coming in, and Dr. Adelsheim, either I can read them for you or you can go through. We have questions. Let me read it for you. The first question is, how can we distinguish between the teenager's meanness or being cool from early sign of depression? My daughter just found out her friend has been cutting herself. She learned this via their social media group. I'm not sure whether the mom knows about this. How can we help this girl? Self-hurting is not necessarily a sign of a suicide, isn't it? Seeking help is not easy, especially at an early stage.
Right. Well, there's several questions in that question. You know, it's a really good question. I think the first thing that I would speak to is this question of how can we distinguish between the meanness. Oh, where'd it go? It's gone. That's all right. So, you know, the first thing I would say is that one of the things that we often see with young people when they're depressed is irritability. And when you look at the diagnostic tools that we use to look at diagnosing depression in young people, irritability is often present, and it's one of the regular signs. And you know what I often find when I'm interviewing a young person around this question, what I will often ask about is whether or not that young person sort of feels like little things that didn't used to bug them bother them much more than they used to. Or do they find that their fuse is shorter, where little things that didn't used to get them angry now cause them to be really mad much more easily, to the point where it often surprises the young person. They may not let you know it surprises them in the time, but as they reflect on it, I think they often are surprised at how strong their response is, or how little tolerance they might have for something that might not have bothered them, whether it's a sibling yelling at them, or finding out they did badly on something, or being embarrassed about a situation. So that irritability is often something, you know, that if we can take a step back with that young person, they really often have a sense for it as well. And being able to ask that question, like, do you find that things are bothering you more than they used to? Do you feel like those issues are there? That then becomes a really important question. In terms of the component about how do we help that young person, you know, I will tell you that I've certainly had times where my children have come to me about a concern about a friend talking about potentially hurting themselves online. And I've had multiple times where I've called up the parents of one of my friends because I just felt like, you know, if it was me, I would want to know. And we generally have conversations with our child ahead of time with the recognition that, you know, if we make this phone call, you know, their friend may not want to talk with them for a while. But if we don't do it, something really terrible could happen and they would feel bad about it for a really long time. And that is it worth risking their friendship to ensure the safety of their friend? And so, our kids over time, and, you know, part of it is having a psychiatrist parent though, right, have gotten comfortable and used to doing this and appreciate the need to be able to reach out to families, and I think see mental health issues as less stigmatizing. So, you know, I have made that call, and I will tell you there have been some families that have been very grateful and others that really minimized it and said, you know, our child's right here, there's no problem. we don't know why your child has this idea. It makes no sense. And, I think all we can do is help our child understand, make a decision with them, and, make that choice together to talk to the family with our child understanding the risk it means. And I will tell you that in every situation in which we've done it, and it's, I guess, probably 4 or 5 times as a parent, the friend might have been mad for a day, but that was it at the most. And then things were back on track, after that. In terms of cutting, and forgive me for going on, but there were like 3 questions in that question. Yes, it's true that there doesn't need to be, that there's not necessarily an increased suicide risk with young people that are cutting themselves or self-harming, but it really is a clear message of a need to get additional support and treatment and helping that young person find other strategies of coping, because there could be a moment that in an impulsive way, a young person could act in a way that wouldn't be safe. And so as much as we don't equate self-harm and cutting necessarily with suicide risk, it still is really important to address the issue directly and safely right away.
Yeah, okay.
The next one.
Right, thank you. For the next question, our family had a trauma and my husband ended up in prison. I've tried putting my 16-year-old in therapy, but she didn't talk. She also wouldn't talk about what happened at home. She doesn't seem depressed, but I know she has to face what happened. What are my options?
Well, I'm really sorry for the trauma that you've had to face in your home, first of all. I guess my sense would be that I don't know if within the context of the experiences your child has had, whether or not there are any programs for other young people that have experienced trauma that they could potentially be a part of. I know that many schools have developed a model on intervention for trauma in schools, CBITS, which was developed by our colleagues at UCLA and the RAND Corporation, which a lot of schools in Los Angeles and Southern California are using as group processes for young people outside of the home to come together to get support around their trauma. I think also for many young people, sometimes it's if they can start out talking with another young person that has faced a similar situation. I don't know if there are any youth programs in your community where there might be other young people who, as a peer support person, could have those first conversations, with your daughter, and then be able to allow them to feel comfortable hearing about someone else's experience, helping normalize it, and then maybe creating some opportunities for them to open up in another setting. And sometimes being in a group and hearing other people talk about their issues initially might be easier than just sitting alone with a therapist. Or again, a peer network might be another way to think about it.
Okay, the next question. My nephew, age of 10 in LA, has been diagnosed with autism. He has no friends and always being seen as an outcast in his class. Should we be worried about his condition escalates to psychosis, suicidal behavior?
Well, certainly young people that are dealing with autism-related issues can develop other kinds of mental health related issues. I think part of the issue really for your nephew is, how it has been for them to not have the social supports to be able to interface with young people. And because there's a whole range of what is considered autism, it's a little bit hard to answer your question. I don't know that in most cases, initially for young people that are dealing with autism spectrum illnesses, as much as they may be challenged in terms of their social interactions, I think there are potentially ways to help them link, whether it's to other young people with autism or other caring adults, and be able to get other ways of getting social skills development. I think there are a number of programs I know in the communities around the peninsula for young people that have autism spectrum illness that can come together for really structured social events to learn how to and have some of that social activity with other young people. And I would be looking for some of those kinds of programs to be able to sort of have some practice having those kinds of social experiences.
All right, okay, thanks. And I believe the audience also replied. And thank you, Dr. Adelsheim. This really helps. I know what to do. Okay. I will contact the girls' parents. Okay. So next question is my 15-year-old son locks himself in his bedroom all the time since pandemic, except getting cold food from kitchen in the middle of night. Even a gentle knock on his door will trigger his extreme anger with loud yelling back, "Leave me alone." And should I be concerned? What can I do?
Well, it's a really good question. I do think we're seeing lots of young people isolating themselves more. And I think one of the things is, as you're trying to check in, I think it's important to consistently be doing it. I think part of the question is trying to understand to what degree these were issues, I think, before the pandemic. I don't know how isolated your son was from you before this situation, but one of the questions is whether or not really this is really a big change from how things were when he was going to school and how much more isolated he is now. I think in terms of being concerned, yeah, I think I would be a little bit concerned, because I think as much as our young people are isolating, that doesn't mean that they're sort of just cutting themselves off from us. And so also, if most of the time he's going out in the middle of the night, that also means he's probably not on a safe and regular sleep schedule. And one of the things that we tend to get really concerned around mood or other kinds of issues is poor sleep and poor sleep quality. And so when your young person's coming out in the middle of the night, it also means their sleep cycle is off as well. So given the isolation, given sort of the sleep issues that you're talking about, I think it might be important to figure out how to, whether it's through bringing in a friend maybe of your son who could help you get an entree to have a conversation, or figure out some way maybe when they're coming out to get food to be able to check in. But I think I would let them know that, you need to get some real sense of what's going on, or even if you could structure a way that, well, you can spend time in your room, but we need to be able to have time to check in with you on a regular basis for this much time every day so that we can be sure that things are okay. So I would try to follow through intensively. And I think your intuition about being concerned, might be realistic, and I would keep trying to find ways to build the connection.
Okay, next question is how do we make our kids resilient?
Okay, it's a really good question. I think that one way that we can help make our kids resilient is, for one, as I mentioned before, letting them know about our challenges and how we have handled them. I think being able to help our young people fail at things and then help them strategize about how to turn things around. I mean, acknowledging that they're sometimes going to fail in situations and help them cope with it, help them find strategies to do that, all become really important. letting them know about the way we have found ways to deal with situations becomes important. And I also think resiliency is built from being able to have connections with other people, being able to face challenges with colleagues and friends, and finding ways to manage stress, whether it's through a physical activity or a hobby that's really of value, whether it's through learning how to meditate or some other related service. But all of those types of components that we can fall back on as stress management, that we can model for other young people and our children, become important ways. And to allow for young people to experiment and try things and see what works and see what doesn't in a way that we might generally be less willing to do. So I think those strategies can all be helpful.
Yeah. Okay. Thank you, Dr. Adelsheim. It's now 7:30, but we still have questions that keep coming in. Will you be able to stay a little bit longer to answer more questions?
Yeah, I can stay a little bit longer. Yeah.
Okay. Thank
I
you.
don't know that we're going to get through all of them, though.
Oh, yeah. Okay. So we have to select the questions. I think some questions probably directly related to the allcove. So questions is about how can kids get involved with the allcove programs? That's one question.
So let me quickly say that right now, we're working with the communities that I mentioned to build youth advisory groups and to build ways to develop access for support. Outside of those communities, we're interested in working with any communities around the state, or frankly, even others around the country that want to build out this model. And so I think if there's interest in looking at how one could get an allcove program started or how to work on developing that model in your community, we should have a conversation and think about if that's a community where we've already connected with some people or some young people and see how we could start working together around building the community and youth support. But if there is a community that I mentioned that your young person is in, we can help make the connections to their youth advisory group or to the people that are developing the program so they can become part of that network and work on that together, fairly quickly at this point.
Okay. All right. So there are questions about preventing suicide and the mental health crisis in children and teens with autism spectrum disorder.
It looks like someone's referencing a book there, right?
Yeah, it's by somebody. Yeah.
Yeah.
Referencing.
So
yeah.
That's maybe a helpful reference for people that
Okay.
asked the question previously.
Okay.
I will answer the one other question. How do we select young people for the youth advisory group? Generally, what we've done is, and we've really so far just started the groups in Santa Clara County, but we've been working with San Mateo County on their group. And, basically, we've really just done open applications and used word of mouth through other young people, other health and mental health organizations to get the word out that we've been looking for people. And we've had young people sort of fill out a questionnaire online about their interest. We've really tried to bring people in to support these groups from really to reflect the diversity of each community. And then also, so we're looking for young people that also have a range of mental health experiences, whether it's lived experience or a family member or an interest. So people tell us why they think they would be good members. And generally then there've been interviews that have taken place where our youth advisors interview the other young people that are applying and then make recommendations to our team about who they think would be the strongest youth advisors that fit whether it's ethnic or LGBTQ or other ways of ensuring mental health experience diversity as well. Let's see. I don't have a book list immediately.
Yeah, I think, yeah, question regarding allcove, how can teams get involved in allcove in Bay Area? I think those are also answered, and I think it's several questions regarding how can we help.
Someone's asking about if Maryland has something similar to allcove. What I can tell you is that we've been talking with quite a few people in Baltimore about starting a site in Maryland, and have had meetings with folks there. And
that's great.
I've had some presentations to the Baltimore City mental health people around this model as well. Yeah, there's still a lot of questions. Let's see. Let me end with this question, which is around social media and how it's impacted children's lives. I think, certainly right now, the struggles that we're seeing around screen time, whether it's now screen time, not only on phones, but in school, has really been a challenge for everybody. And, part of what we've been trying to look at is not only the challenges of social media for our young people, and certainly those are there, but the potential benefits as well. And so we've been doing some focus groups and meeting with young people around, what would you like to see in a positive way around social media? And I would recommend a study to you that was done by folks at Hope Lab and the Wellbeing Trust. I don't remember exactly the name of it, but if you look them up together, they did a study on the use of social media with young people with depression. And one of the things that was really interesting about it was that, many of the young people with more serious depression, on the one hand, found social media really difficult because they would see other young people showing their lives on whether it was Instagram or Snapchat in very positive ways, where the images were always positive. They were with lots of friends, going to lots of parties, getting lots of likes on all their things. And for young people who were depressed, they looked at these other people's lives and felt like, my life is nothing like that. And my life feels so much more painful. And I'm not getting any of these likes. And in that way, social media was really painful. But at the same time, these same young people were also able to seek and find often other websites where young people talked about their own struggles with depression, their own struggles with friends, could make references available to other friends about, this is a really helpful site if you're dealing with problems with depression or anxiety. And, sometimes there are chat groups that were very positive and supportive for young people as well. And so part of what's hard, I think, with social media is that, there really are a couple sides of it. And it isn't necessarily an all bad thing. And certainly for young people, it presents a lot of challenges. But so I think part of what's hard is building healthy structures around it in terms of phone time. I think we as parents need to model appropriate screen time, not if we want a family meal, to not be sitting on our phones during that time or leaving and responding to things, but really saving time for everybody to be together where we're not getting on our phones, and then being able to find ways to, have that direct communication with each other. So I think the social media piece, it's with us, it's gonna be with us. Right now we have even more of it, but I think also then having these conversations becomes real important. So let me stop here and just say thank you for the chance to visit with all of you. Thanks for the great questions. I'm sorry we couldn't answer all of them. And again, I really appreciate the chance to visit with everybody tonight.
Dr. Adelsheim, thank you so much for the wonderful presentation and also answering so many questions. And also thanks everyone for attending our webinar. And please stay tuned for Alan Hu Foundation future lectures. And please take a few minutes to do the survey and provide us with your valuable feedback. And we are closing this webinar now. Thank you, goodbye, and stay safe and stay healthy. Thanks, everyone. Thanks.